Hi everyone, Nigel here again from Hand Pain No More. And today we are going to talk about trigger finger. So trigger finger here, right? Is one of the most common conditions that I treat, at least in my hand therapy clinic. And what happens is that for patients who develop trigger finger, one or more of their fingers get locked in a certain position, like this, and they cannot straighten it without difficulty or cannot bend it without difficulty. And sometimes jokes that, oh, I feel like Spider-Man. Uh, Jokes aside, right? It can be quite painful, quite uncomfortable because it's just irritatingly bent. And the story of how the back history of how the name trigger finger came about is because in the olden days, where during the wartime, right, a lot of soldiers who use guns, right, they keep clicking on the trigger button because to shoot, right? And eventually they develop this condition in their index fingers, this clicking, this trigger kind of feeling. And that's how they coined the term trigger finger, right? So it can happen in any of the fingers. Typically, it happens at the lower level. That means at the base of the fingers. In some cases, it happens at a higher level over here. So most of the time, again, I point out to you, it's at the lower level like this. Point to here, like this, right? Most of the time, it's here at these levels, but in some cases, they happen up here, higher up. And it's usually tends for people who do a lot of hook kind of grass, like like rock climbers. So, but for this sharing, we just talk about the basic one. So what are the common symptoms is that patients always complain or report of finger stiffness in the morning or with periods of rest and inactivity, right? Patients will say that there's a popping or clicking sound. They will know it's unmistakable. It's just poop, just go into position, or poop, go straight again as they bend and move their finger. In some cases, patients can feel a nodule. Let's say if this is a painful finger, they can feel it like a bulge, a nodule that's very tender. Some patients feel it's very painful. Some patients don't feel it's painful at all. Most of the time, it's painful, right? At the base of the affected finger. And then, of course, as I mentioned earlier, the finger locking or finger catching in a bend position. For mild cases, you can lock and unlock quite easily, even though you can feel a click. For some really bad conditions, if it's so advanced, it can't be straightened. So that one you really need to see a doctor, probably get injection or release. The main cause of it is that because the tendons are getting stuck because there's a sheath outside the tendon, it holds the tendon inside like this, and this sheath, because of inflammation or infection, it can swell up, and then it squeezes onto the tendon, right? So what happens with this case is that eventually, if it's not managed well, right, or not managed after a long period of time, there can be more and more scarring, and then that's where things like these nodules form, right? And this ball like nodule makes the catching even worse than before. Again, not most of the time you don't need surgery for this. Actually, most of the time can be handled conservatively. I'll share more with you later. Who's more at risk of this is anybody whose work, hobby, or passions involves a lot of gripping, especially resisted gripping. So think about people who use shears, who cut stuff, wire cutters, people who do a lot of manual labors, people who even in fact people who do a lot of carrying weights, pull-ups, push-ups. So the stronger the pressure and the grip that goes through the fingers, the more at risk you are. Certain health conditions, such as having diabetes or rheumatoid arthritis, puts you more at risk of developing trigger finger. Again, also trigger finger is more prevalent in women, simply likely because women tend to have smaller muscle mass, and then pushing them to have more exertion to push things forward. For example, a man cutting using a shear will be easier for him because he's just taller, longer, bigger muscle mass compared to the lady, so they exert more. And lastly, trigger finger may be a complication of a carpal tunnel release surgery in some rare cases. But again, as I said, most of the time, this condition is actually very conservatively managed. Most patients don't even need surgery, don't even need injections. So when patients develop this kind of trigger finger, what we do for them as hand therapists, depending what stage that they are in the having trigger finger, we almost always create an anti-trigger splint. So this will prevent the patient from being their finger this way. So just let it rest, right? The whole story is about letting it rest. So anti-trigger splint is one. And then we teach them some trigger finger massage. I'll come up with another video for that, as well as lots of nice good ultrasound to accelerate the soft tissue healing. And as patients compliant, they do it for around 6 to 8 weeks. They just compliant, don't aggravate it more. 6 to 8 weeks at most. 6 to 12 weeks at most, So that's all I want to share with you about trigger finger today. Watch out for my next video on trigger finger, where I teach you the specific massage and what some things that you can or shouldn't do for your trigger finger.